with a vaccine like this, where, what are we talking about? 6 months, 8 months? I mean, we don't know what the long-term side effects of this is. The fastest vaccine we've ever developed was the mumps vaccine, and that was about 4 years. The last vaccine we developed where they actually had a man-made particle, because remember, this messenger RNA is not something they just, spliced out of nature. This is something that they actually created in a lab.
Thanks for listening. If you like the candid discussion and are seeking the truth behind the mainstream narrative, then please subscribe and share. Not only am I grateful, but those who seek the truth and wish to empower themselves and their family's health, freedoms, and future will also be grateful. You bet. So Dr. New hails from Ann Arbor, Michigan. He is in integrative clinical practice, and he's going to share a lot about what he does and why and how he got here to this stage. The first thing I want to do is thank Dr. New for being one of our speakers and presenters at VaxCon 21, which is upcoming April 17th and 18th. So for those of you who are wondering what this is about and whether it'll add value to your knowledge and or your patient base, this is going to be some crucial information. So thank you today, Dr. New, for taking some time out and sharing with us a little bit about your background and what you bring to the table for chiropractors throughout Wisconsin, but actually all over the world.
Awesome.
No, you're awesome. Thanks for being here. So I'm just going to ask a couple basic questions so folks can kind of gather where you come from and how you got to this point. So can you tell us a little bit about your practice, where you were in the past, and how you got to this point?
Sure. So my practice is primarily integrative medicine. I always say I don't throw out the baby with the bathwater. So I still prescribe medications if I think that's the appropriate thing. I mean, mainly I'm using my license to order labs and tests and that sort of thing. But this all goes back to, after I graduated from medical school, I actually went into a surgery residency at the University of Michigan because I thought when I went to medical school, they would teach me how to cure people, how to heal disease. And, I know it's a little naive, but they have medical school. They teach you about drug, surgery, radiation, and I happened to be good with my hands, and surgery was a blast, and I went into surgery. But when you're even in that profession, I was like in my third year of surgery, and I remember whacking out half this guy's colon because he had colon cancer, and the first thing any reasonable human being would say after that kind of experience is, "What can I do to make sure this doesn't come back?" And I didn't have the answers. I mean, they didn't teach me any of that stuff. So that sort of got me looking at what else might be out there. And at that time, my ex, she had some health issues I tried to help her with all the medical stuff I knew. Didn't make all that much difference. And a friend of hers said, "Oh, you need to go see an herbalist." I had those problems. I saw an herbalist. I was all better. And I remember her coming home from seeing this guy, and she had a box with homeopathics and supplements, and we're changing how we're eating, and we're doing this and we're doing that. And of course, being the supportive husband, I sort of went, yeah, whatever. But she got better in like 3 or 4 weeks. I mean, that was really a wake-up call to me to say, dude, there's this whole world out there that you know nothing about, and it's actually healing. So I ended up spending time with that herbalist. I interned with a homeopath. I ended up learning acupuncture, and that's kind of how I started. Now, this is ancient history at this point. This is back in 1988, and it's been a long journey ever since then. So really, my practice right now is how do we approach a patient that has chronic illness? How do we address the issues they have? And really what we do is, people come to my office, they say, I've seen 20 different doctors. And I want to say, no, you've seen one doctor 20 times because they've all done the same thing, right? So by the time they come see me, we're looking more at how do we measure functional processes of the body? How do we figure out what's underlying a person's symptoms? Because they may have 20 symptoms. Usually the way biology works, those 20 symptoms are coming from one, maybe two things. Your job or my job is to figure out what are those things. And that's really what has been the reason behind the success of my practice is to really get to those underlying conditions. Now, in the process of doing that, what you find is, I started hearing these stories from people. I was fine until I got this or that vaccine. I didn't know any of this stuff. Vaccines, savior of mankind, blah, blah, blah. That's what I was taught. And that sort of got me interested in this whole idea of vaccine safety, because again, this is not something they teach anybody in medical school, nursing school, any kind of professional school. And that's what got me into this whole world of vaccine safety. And that's, I've been doing a fair amount of advocacy in the last few years with that. But I continue to have an integrated practice. And again, I think we help a lot of people that are chronically ill that really are not finding help anywhere else. And the beautiful thing about my practice is I'm kind of ADD. I get bored real easily. And every week somebody comes in, sit down. I listen to what I call their tale of woe. And when they're done and I'm done with my evaluation, I have to tell them, I have no idea what's wrong with you, but we're going to figure it out. And that's kind of what makes it great for me, because it feeds my brain and gets me looking deeper and deeper, and what alternatives are out there, and even having to learn things like chiropractic. There's actually a function out there for chiropractors. They don't teach you that in medical school either. So, but anyway, wow. It's been a great journey. The last 30 years that I've been doing this, it stays interesting, and I've been doing this long enough that you see the progression of illness in our population. We are just, if COVID's taught us anything, we have really crappy health in the United States.
Yeah. And I think that's you get a resounding answer from most of us chiropractors from the realm. I would say, I speak for all, but many of us, knowing what we're up against in this whole, mainstream and industrial medical complex, so to speak. So number one, congrats on your working through that process along the way and just staying open. It's easy to not, it's more comfortable to not, to ignore some of these things as we go and just go through the motions, especially when the model is that. So you're doing something different.
Right.
When you see the chronic disease pattern, you had mentioned when we spoke earlier, it was, the recognition of, you'd said a lot of your patients are coming in and you're treating chronic disease. And let's backtrack just a bit onto causative factors, or go upstream. In your likelihood, you're a presenter for our VaxCon and you're not anti-vax, which is awesome. You're looking at it, as you stated, from vaccine safety. So tell me what you're seeing in practice that connects the chronic disease, just to lay out the obviousness of this.
Well, you have to remember that most of us that are doing the kind of work that I do believe that this chronic disease is linked in with environmental toxicity. So that's a generic term. So that toxicity could be mold toxins, because we build our houses differently. They're a lot more energy efficient, but it means mold is a much bigger problem than it was 50, 60 years ago. It's all the garbage that's in our food stream, from agriculture, processing the food, all the stuff that's added to it, all the stuff that's left over from the actually growing the food. But that sort of leads you down this road of, well, what's the one toxin we actually inject into people on a regular basis? And that's what gets you into vaccines. Again, it wasn't even in my wheelhouse when I first started practicing. I'm looking at, you need to change your diet. You need to get rid of sugar. You need to get rid of simple carbs. You need to go organic. You got to, you need to drink clean water and stop eating crap and blah, blah, blah. And that worked fine for a while. But then you have to get to a place where you go the next step. Okay, that didn't work. What's next? Well, now we have to look at the environmental toxins. How do you detox those? And then ultimately we get into the injected toxins. And that's what got me into the whole vaccine safety issue is, patients would tell me that they were fine until they had a flu vaccine. And then they feel like their whole system started backtracking after that. And I think we lost you. There you are.
No, I'm just giving you the screen because people want to see you when you're talking. So I love this. And some of it seems, if I'm asking an obvious question, we get a lot of lay people listening to this podcast as well. But since the lay public is invited to this conference as well, these are really, they hear certain things. People hear like the mRNA has possibly a rewriting capacity or an effect, let's just say, on our DNA. And they might hear this, they might read it, they might see it from some of our other speakers and whatnot, but they're really not being supported of that evidence in the mainstream. So when I'm having you state this, it might be like a broken record for you, but the bottom line is people don't hear it enough from sources credibly such as yourself to support their decisions. Go ahead. What's your take on that?
Well, I mean, you have to remember that most of the chronic disease that I see is based on immune activation, that something in the environment is pissing off the immune system. The immune system is just spinning its wheels and creating all these symptoms for us. So, you can say, oh, they have chronic Epstein-Barr, or they have chronic Lyme, or they have chronic Candida or something like that. But really what it is the symptoms are coming from this immune system being chronically activated. So typically when we're talking classic vaccines like the Tdap or Tdap or the polio or measles or any of those, many of them, not so much the measles, but the other vaccines, they use what are called adjuvants. So typically this is going to be some type of aluminum, and the entire function of that adjuvant is to stimulate an immune response. Now, when you fast forward to this COVID vaccine, at least the mRNA vaccine, they don't need an adjuvant for that vaccine. When they did this phase 1 trials for both the Moderna and the Pfizer vaccine, these were healthy people. I mean, Moderna, I think they were 18 to 55-year-olds, and almost all of them were white. They were all healthy, and they all, 100% of them, had a significant immune response to the vaccine. Now, they're looking at it as, great, that means the vaccine's going to work. I'm looking at it as, what is this going to do to the person that's susceptible? Because they're dialing in these vaccines for sort of the generic immune response. And we all know there's a bell curve with everything in biology, and they're going for the middle of the bell curve. Well, if you're one of these patients that's on the overreactive end of that bell curve, and they give you a vaccine that's expected to give you this much response, and you're on the overacting end of the bell curve, all of a sudden you're not going to have this kind of response. You're going to have this kind of response. And that's why we're seeing people have these, fever for 2 or 3 days, can't get out of bed, that sort of thing. Okay, you'll get over that. But what happens if you have a predisposition for an autoimmune disorder or some other chronic illness? You're just off to the races. And the trouble with these kinds of vaccines, it's I always say there's many things that lead you up to the edge of the cliff, but it's one thing that's going to push you over. And if that vaccine is the one thing that's going to push you over, you can't just take a step back and be back to where you were. You got to climb that 10,000 feet back up the face of that cliff if you survive the fall. And that's what happens with some people with these vaccines. And this is what, unfortunately, my profession will not recognize, admit, research. They're terrified that if they identify anything wrong with the vaccine, that everybody will suddenly stop vaccinating. So they don't even look, they don't research, they don't, if you ever want to end your career as a physician researcher, just do some research into vaccine safety and show something negative. All right, they'll just wipe you right off the map like you didn't exist. And that's scary. And especially with a vaccine like this where, what are we talking about? 6 months, 8 months? I mean, we don't know what the long-term side effects of this is. The fastest vaccine we've ever developed was the mumps vaccine, and that was about 4 years. The last vaccine we developed where they actually had a man-made particle, because remember, this messenger RNA is not something they just, spliced out of nature. This is something that they actually created in a lab.
What's the most cost-effective, most affordable, and portable way to get into infrared sauna technology? Therasage360.com. Use code FSDW360 for your discount today. Delivering results that last.
So the last man-made particle vaccine was a HPV vaccine, Gardasil. It took them over 10 years to develop that. And here we have a vaccine that we have in 6 months. And everybody says, oh, yeah, they've been working on messenger RNA vaccines since the 90s. Yes, they have. But they failed every single time they tried it, right? They tried it for Zika. They tried it for Ebola. They tried it for hepatitis C. They tried it for HIV. Failed. And all of a sudden, in 6 months, we have a successful vaccine against COVID. Now, It may turn out to be a great vaccine. It may turn out to be a completely safe vaccine. But we can't say that after testing for 2 months. And that's what's scary about it. And there's really, really scary thing. And, again, I'll get into all this stuff when I speak in Wisconsin. But when you get in, the really scary thing is if you look at all the vaccines on the schedule, because people are saying, oh, they only looked at COVID for 8 weeks. I want to say, that's 2 weeks longer than most vaccines. It's really terrifying.
It is terrifying.
What they consider to be safe. And it's, there's a group called the Advisory Committee on Immunization Practices, ACIP, so we call them ACIP. They're the ones that determine what goes on the schedule. And, these are the people that I want it to be. These are professors, they're academics, they're, well-versed in their field, well-respected, all that sort of thing. And I go to these meetings. My wife dragged me to one of these meetings. She said, you will not believe what's going on there. And I actually went to one of these meetings and I listened to them, listen to speakers present evidence, okay? And they don't bat an eyelash. We're going to compare a quadrivalent high-dose flu vaccine in the elderly to a DTaP. And guess what? Did you know the high-dose quadrivalent flu vaccine prevents the flu better than the Tdap vaccine? Wow. Why didn't they compare it to a trivalent high-dose flu vaccine or a normal dose quadrivalent flu vaccine? Or if you're going to use a Tdap, why not use a saline, right? None of that. And they don't bat an eyelash on that stuff, and they know what good research looks like. And they just let all this crap research be what determines vaccine safety and efficacy. And that's, again, the nice thing about COVID is people get to sort of have a front row seat to the whole process. Nobody's doing the research in medicine on safety. They just assume it's all been done. And until you actually go in and you read these articles and you read what the CDC uses as justification, it's just like, your brain explodes. It's like, how can you do this? There's 4 million kids born every year, and some of these vaccines are given 3, 4, 5 times. I mean, do the math. You should be testing these on at least tens of thousands of kids. You should have safety studies that are lasting a year, 2 years, 3 years. And it's just not happening.
Interesting. It just smells like corruption to many of us, but of course you can't say that. You can't assume it either.
Well, I'm going to give some credit to my colleagues here. You have to understand, I don't know what it's like at chiropractic school, but in medical school and in residency, you're in with a bunch of people that are speaking and thinking and acting the same way. You're sleep deprived. You're in a hospital setting. Everyone around you is doing exactly the same thing. It's very easy. I'm going to call it brainwashing, but it's very easy to get brainwashed into a certain way of thinking. That because your professor says, you circle 3 times and tap your forehead before you inject the lidocaine, that's what you do because you go to the mountaintop and that's what the guru told you. You don't ever question it because that's a quick way out of medical school the wrong way, right?
Right.
They're going to drum you out of there. So we're not taught to question. We're just taught to accept whatever we're told. And it's really hard. Even where I'm sitting, I've been doing this for a long time. Even where I'm sitting, it takes a lot for me to really say, well, wait a minute. Why am I doing this? Just because I've always done it this way? Or is this really the best way to do it? Is this the way to do it that has the most evidence behind it? And that's part of what's going on with these vaccines. We've all been brainwashed into their safe and effective, safe and effective, safe and effective, safe and effective, to the point where these 2 COVID vaccines, the messenger RNA COVID vaccines, really the only thing the manufacturers could show was that they prevented or appeared to prevent mild to moderate disease. They couldn't show that they prevented death. They couldn't show that they prevented hospitalizations. They couldn't show that they prevented transmission. Those are the 3 reasons why you would vaccinate. And they couldn't show any of those. And yet it's being adopted by the entire medical community as though all those things are true because vaccines are safe and effective. We all know that. This is a vaccine. Therefore, it is safe and effective. It's almost, again, every day my brain blows up, so I have to put it back together at night and get ready for the next day.
You're going to be around a group of free thinkers, so to speak. That's where, I would say, not as a rule of thumb, but I would say as a general rule, we question, and probably absolutely to a fault at times, questioning the process. Right. But it does just come back to a simple process that the body's self-healing and self-regulating. It doesn't mean we don't need medicine, but we're asking the question about when does it become super toxic, over toxic, or harmful to the body. And you mentioned some of those things, and we're familiar with thimerosal and the adjuvants, which is a great window into that. You're going to get into great detail coming up this next month, which we're all excited for too. I am so incredibly excited to hear you as a medical doctor, your clinical history, your expertise, and the fact that you ask questions. That automatically says to our whole audience, respect, because it's not just the next person in line going through that same model and just reiterating the same dogmatic approach, so to speak, rather than just saying, wait, whoa, something's not right here.
Right.
And it takes courage, and I want to acknowledge you for that. I know in front of your colleagues, it may not always be easy.
Colleagues, what colleagues?
Bye-bye. See ya. You've been ostracized.
No, I mean, the thing about it is that there are enough of us out there. And unfortunately, with the shutdown from COVID, it's been hard to, I go to a lot of conferences, some of which I speak at, some of which I attend. But the whole thing with conferences is, the information itself, you can get that online. But what you don't get online is, sitting down with somebody, over a beer or something and actually getting into the blood and guts of what you're doing. And that I miss. And I miss the interaction with colleagues, because there are colleagues out there. They're just few and far between. There's a certain percentage of doctors that if you gave them the opportunity, they would jump to do this sort of stuff. It's just that they are all stuck in a system that doesn't allow them to question.
Right.
You do X, Y, and Z because that's what the protocol says. And you don't ever step out of that protocol.
Right.
The reason why I can do what I do is I have a private practice. I don't, as long as I don't violate any board ethics, I can look at somebody through a different lens. And everybody who walks in the door signs a consent that says, I don't follow the standard of practice, the standard of care. And that's why they're there, because the standard of care didn't work for them. I'm not faulting doctors. I'm not saying that medicine doesn't work. I'm just saying it doesn't work for everybody. And those are the people that I see in my practice. And again, these patterns that I see: chronic immune activation, depletion of the system, nutrient deficiencies, and then toxin. I really think that's why the US has such a problem with COVID, is that the toxicity has generated so much morbid obesity, type 2 diabetes, heart disease, all these things that, especially the obesity and the type 2 diabetes, everybody wants to blame it on McDonald's and, Coca-Cola. But, we had McDonald's and Coke when I was a kid. Nobody in my class was obese. I mean, maybe we had one fat kid, but that was it. Nobody was obese. And now it's half the kids. And that's part of that. That's part of that environmental toxicity. And you look at the health of our kids and how many of them have chronic illness. And again, 20% of my practice is kids. And it's just heartbreaking to see this stuff. And the parents don't know. And unfortunately, the pediatricians don't know either. They don't know what it is. They just know it's not vaccines, not because anybody's proven it's not vaccines, but because vaccines are safe and effective, safe and effective, safe and effective. And it becomes a mantra and a religion and not science. And last I checked, I'm supposed to be a scientist when it comes to evaluating patients.
Right. And then we hear the mantra, the science is real. And my question back is, which science are you referring to? The one where you put a seed into the soil, and with sunlight and water, that seed grows into its destined pattern that's, within its structure, right? Its vital force. Or the science that is sponsored by the NIH, some gentleman who actually appropriates funds to the right research that goes to the appropriate group that actually can perpetuate the agenda that's needed to be perpetuated. I don't know. That's just a theory. We already know where that tends to put people because it's uncomfortable. The bottom line is, you're telling us there's real life evidence that walks into your office every day. The point that you challenge thought and ask questions is just like a curious kid that says, wait, something's not right here. And I know where to start looking to find it.
Right.
Yeah, and that uncovers a lot, doesn't it?
Right. And even when I don't know, because like I said, at least once a week I have somebody where I get done and I don't know. But the beautiful thing about where we're at now is, back when I first started, because I'm old enough to have to do this, I would actually physically have to go to the medical library, actually pull journal articles, journals off of shelves, open it up, find the article. And if I wanted to keep it, I'd have to go to the copying machine and copy it out of the journal. So, the internet's been a wonderful thing to help us. PubMed just has a gazillion articles in it. So you can research this stuff and see what other people have done. And that's really what helps move things forward. The important thing is, I have the luxury of being able to do that. I am not limited by some corporation that says you get 5 minutes, 10 minutes, 20 minutes with a patient. My shortest appointment is half an hour. My new patients, it's at least an hour. Kids on the autism spectrum, it's an hour and a half, because they're usually pretty complicated. And that gives me the luxury to think, to process, to go beyond just, here's the protocol, this is where you're at in the decision tree, so the next step is this, because that's the way you're taught to practice medicine. I'm board certified in emergency medicine, so I know all about decision trees. That's how you practice ER medicine, and it works in that situation because you really need to very quickly go through the possibilities, X, Y, Z, make sure that your patient isn't going to die in front of you because you missed something, and then go to what the causes are. But with chronic disease, you do have the luxury of thinking about this, and unfortunately in medicine, practices aren't set up for that. Doctors are not stupid. I mean, doctors are smart. They're you have to be to get through medical school, much less get in. And for them to be stuck in a situation where it's like, no, you're not allowed to think. We just want you to do this protocol. It's just crazy. And to think you're going to get the best health outcomes from that is even crazier, right? I mean, I'm not the only one that can think. Most doctors can think. It's just they're not allowed to.
Oh, that might be just the best quote to end on right there. I was just having this conversation with a patient the other day who asked, it's like, why won't my doctor look at these things? It's the same test. Why are they not? We were looking at functional labs, and I look at it functionally versus, highs, lows, or out or in versus. So anyway, it's just, I can't speak for that other than to be gracious that the intentions are great. The docs are smart. The system just has them running ragged, and they won't allow them to deviate outside the lines. That's kind of what I just heard.
Yes.
So,
pretty much it.
Putting it in perspective, when we come back to patients, that's what I'm excited about, patients being able to hear, and my staff to hear from you and go, wow, this isn't just Dr. Antonsen. This isn't just Dr. So-and-so in my chiropractic office who's talking like this. That's where you're going to add tremendous value. And not only will you have the respect of us as chiropractors in that room, but you're going to have the audience that's ready to hear a message that you're doing. So we love it. And thanks for being courageous. When did you break off from the model of surgery and being, institutionalized to being, your own thing, and being able to use your protocols and run your practice like you want?
I actually made the split in 1988. So that was 3 years. I actually left my surgery residency. So that was 3 years into my surgery residency when I sort of saw the light and just went, do I really want to do 2 more years of this when I don't believe in what I'm doing, or do I want to pursue my education in integrative medicine? And that's what I did. And, at the time, there really wasn't anything formal. You didn't have IFM. You didn't have all these programs in naturopathic medicine. You had the Bastyr Institute out in Oregon or Washington State, wherever they're at. That was it. You had to leave the country to get trained. So I basically went through the process of training myself, and that allowed me to get to where I need to be. So,
one second. I think my wife just started running the shower. Hang on one second. You're back on.
Okay. All right. Yeah. So, that's what started me on the road, but to actually, to get to where I'm at today, I mean, that's taken many years of having my patients teach me, because that's the other thing. I mean, every patient that walks into your office is probably going to teach you something, if you're willing to learn. And that's, that's the process that's got me to where I'm at today. So it's been a very, very long time that I've done this. Now, it helps for somebody starting now that there are all these organizations, there are conferences, and that's what makes me so excited about this conference, is because you just don't get to speak to a large group about vaccine safety. As soon as you say vaccine safety, you're like off the committee. They're not going to let you speak. So it's very exciting to do this. My hope is after the couple hours that I have to speak on this, that people are going to leave that room and they're going to be experts. They're going to understand why people have concerns over vaccines and where the deficits are in that whole system. And that it's not just the way they're doing COVID, it's the way they've done all vaccines. And then this has just been this ongoing, juggernaut of vaccine research that, you accept a little bit of, rather than having this gold standard research, we're going to let you, okay, maybe you don't have to do the inert saline placebo. We'll let you use something else as a placebo. Or maybe the next step is, maybe we don't need to do, 50,000 people. Maybe we can get away with 2,000 people. And, the next step is maybe we don't need to show that it actually prevents the disease. We'll just measure some antibodies and see if that works. So, it's just slowly over time has degenerated to the point where a lot of vaccine research just is not very good research. I mean, if you read these papers, a lot of times it's like, why didn't they do this or that? And a lot of times it's because they're trying to make sure that nothing bad happens. The reason why we don't know whether or not the Pfizer or the Moderna vaccine prevent transmission is because neither Pfizer nor Moderna did swabs on people. They only swabbed people when they were symptomatic and they had to meet certain criteria. You have to have low-grade fever, you have to have cough, you have to have certain things. So there were a whole bunch of people in both groups that had cold-like symptoms, but they didn't meet the criteria for being swabbed. They could have easily taken 2,000-3,000 people and just swabbed them once a week. I mean, good Lord, we invested $16-17 billion into this. They could have done those swabs for us, and it would have showed, do you have asymptomatic carriers? We know that happens, but do you have different numbers in each group? Because if you can show the vaccine prevented asymptomatic carrier, then you can say the vaccine prevents transmission. They didn't do it because, AstraZeneca, when they did monkey trials with their vaccine early on, they vaccinated the monkeys, they exposed them all to COVID, none of them got sick. They did lung washings to show there was no virus in the lung, and that was clear. But when they swabbed the monkeys, most of them were positive for COVID. So even though it prevented the disease, it didn't prevent transmission.
When it comes to infrared sauna, the technology at Therasage360.com is on the forefront of delivering results safely and effectively. The technology in Therasage 360 is not only affordable and portable, it allows you to access the benefits of infrared technology on any budget. For a 15% discount on all products on Therasage360.com, use code FSDW360. You'll be glad you did.
And these companies are terrified that if they actually do the study, if they actually do the science, they're going to show that it doesn't prevent transmission. So right now we're in the state where we don't have the data. It allows them to say, well, we don't know, but we think it probably does. And besides, if we vaccinate everybody, then nobody will get it. We don't have to worry about transmission. I think that's their plan of action. But, again, this is not science. The science would say you need to swab a subgroup. The science would say you need to follow X number of people for safety. You don't just sit back and wait and see what happens. The science is out there. And if you look at what they're using to tell us that vaccines are safe and effective, it's just not there for that part of it. And that's really what I want to spend time on, is to go through these vaccines, show you how they were approved. And I'm telling you, for some of these, it is just mind-boggling that a vaccine that you're giving, a couple times to 4 million kids just was tested on maybe 300 people. I mean, that's the measles vaccine, MMR vaccine. I mean, it's just mind-blowing. And that's just one example. I mean, there's all kinds of stuff like that. So, for people to understand where people like me are coming from, number one. And then also for people to, let's look at some of the big questions of vaccines. Do vaccines cause autism? Are we healthier because we vaccinate? I mean, we should really know the answer to that question, right? What is the trade-off because we're not, for the most part, we're not vaccinating for Ebola. We're not vaccinating for super deadly diseases. Most of these diseases were relatively well controlled by the time we started vaccinating. You can argue about polio and smallpox. Those were much deadlier diseases. But when you're talking measles, mumps, rubella, chickenpox, come on. We've always had chickenpox. It's not a deadly disease, and yet we're vaccinating for it. So these are the kinds of things we need to look at. What are the trade-offs for what we're doing? When you look at some of the basic questions like, do vaccines make us healthier? That's never been evaluated. I mean, it's just mind-blowing. Why wouldn't you look at that? Well, we have some theories as to why you wouldn't look at that.
Yes.
Right. Because you're afraid of the answers, right? Do vaccines cause autism? Do vaccines cause ADD? Do vaccines cause asthma? Do vaccines cause autoimmune disorders? None of these things have been evaluated in a way that you can actually say yes or no. And that's what we're going to go into. We're going to look at, and what I try to do is just say, let's use the CDC data to start with. This is what they use as their evidence. And then let's look at what else is out there.
Beautiful.
And then let everybody else make their own decision.
I can't wait to meet you in person. It's going to be awesome. So, folks, this is Dr. James Neuenschwander, and he will be in the Dells at VaxCon 21. One of our major presenters. We're excited to have him there. And obviously you can see he knows his stuff, but the best part is he brings another perspective in the medical model as to what questions you and we, your patients have, my patients, and all of us clinicians looking to help make a difference with the health of people tomorrow. So thanks for being here today and taking the time. I know you've got more interviews or more things on your agenda today, so I'll let you hop. Is there anything, any requests you have before you get here?
No, just make sure the bar is stocked and open. Other than that, we're good.
You're coming to Wisconsin. One of the things, you can wear some blue and silver stuff if you'd like, but chances are it'll just open up conversation and jab, non-needle jabs.
You mean you want me to take my coffee mug with me when I come?
I'm going to suggest you don't do that. Something about credibility just is going to change. I mean, right now you're very credible because anyway.
Okay. I'll leave it at home. No silver and blue. We'll
hey, freedom. Do whatever you want. It's cool. You're already a courageous man. So thanks again. It was a pleasure having this time with you. Thanks so much. And we'll look forward to seeing you in basically about 4 or 5 weeks.
Mm-hmm.
All right. Thanks, Doc.
Thanks.
Ciao.
Bye.